I'm Gudrun Novak. I'm coordinator for the Diabetes Center here at Cleveland Regional. I'm a registered dietitian and a certified diabetes educator. Well, diabetes education covers many areas. A comprehensive program will, which is what we give you, covers not only how do you check your blood sugars with a meter, how to use a meter, but we also cover diet, what foods are going to help lower your blood sugars, your cholesterol, your blood pressure. All those things tend to go with diabetes. We also go through the medications that you're taking. Many times people aren't taking their medication correctly, and that makes a big difference on how to control the diabetes. So we make sure you're taking it correctly, you understand the side effects. And then we also talk about problem solving. What do you do when you have a high blood sugar or low blood sugar? How are you going to handle that? What do you do when you go to eat out at a restaurant? How are you going to make those selections that won't make your blood sugars go so high? So we try and give the patient tools that they can take with them to manage their diabetes on a day-to-day basis, regardless of what's being thrown at them. So, and diabetes education covers all of that, and also it covers preventing complications of diabetes. We do tend to review with the patient what happens if you don't control your blood sugars over long periods of time. The one thing we like to really get across to our patients is you can live a long and healthy life with diabetes if you take these steps to prevent long-term complications, the eye disease, the kidney disease. So we teach them those things as well. We start off with a one-on-one visit with each person to really assess, first of all, how much they know about their disease. Are they newly diagnosed and do they know very little, or have they had diabetes for some time and know something? And from that assessment, we decide exactly where we need to target the education. We have a team of registered nurses and registered dietitians. We are all certified diabetes educators, so we specialize in just that. And after the assessment, that's when we decide, do they need the full-blown class that covers everything? Newly diagnosed people come in completely bewildered and confused, and we generally put them into one of our group classes. But if someone's had diabetes for a while, they know how to check their blood sugars, they know how to take their medication, but they need more help with the meal planning, then we'll set them up with the dietitian.
You're referred, basically, the patients are referred, I guess, through their physicians,
yes,
is that correct?
Yeah. We do, and the reason for the physician referral is primarily because most insurances do cover our services, and in order to get that reimbursement, we need the physician's referral. I must say that here in Cleveland County, most of the physicians here know about our program. They're very good about referring patients to us. And quite often, I'll get a phone call from a doctor saying, hey, Gudrun, I heard about this medication, or I heard about this meter. What can you tell me about it? So they not only see us as a provider for their patients, but they also use us as a resource for themselves.